Feel free to join the conversation on Facebook, Twitter and SMS. Our hashtag is NTVTech5. You can get us on our Facebook page, on NTV Uganda fan page. Our SMS number is 6565. Remember to begin with Take 5 or send us an email on tech5@ntvuganda.co.ug. Welcome to NTV.
Thank you, Rachel.
Yes. Judging from the story that we have just seen, we do appreciate the fact that infrastructure is in a sorry state. As the Ministry of Health spokesperson, what are your views and thoughts on that?
Yeah, we realize that we have a number of challenges in the sector, of which one of which is very important, is the infrastructure of most of our health facilities in the country. However, as a sector, we have drawn up a comprehensive plan to renovate health facilities across the country. And with this, we are starting with our National Referral Hospital, which is Mulago Hospital. We have mobilized funds for the renovation of this hospital, and we have in this we have about $88 million to renovate Mulago Hospital. You realize that Mulago is very congested in that it is not even able to offer the services befitting a level of a National Referral Hospital. And with that, we got about $88 million from the African Development Bank, one to renovate Mulago Hospital and also to construct 2 new hospitals in Kampala, and this is Kirudu and Kawempe Hospital. And as I speak now, we have already started on the process of constructing these hospitals, and before the end of the year we shall have started renovation of Mulago National Referral Hospital. We continue to mobilize resources both internally and externally from our development partners. Currently, we are on a process of renovating 9 hospitals throughout the country, and we got a loan from the World Bank. It's $130 million from the World Bank, and part of this, about $52 million has been allocated to infrastructure development, and this is in 2 phases. The first phase, as I speak now, we are renovating 9 hospitals, and this includes 1 regional referral hospital, which is Moroto Regional Referral Hospital, and we are also renovating 8 general hospitals. These are hospitals that are along the highway, because we have many hospitals in the country that have not even received any renovation since they were put up. Most of these hospitals were constructed in the 1960s, 1970s, and they have never had a coat of paint. No renovation has ever taken place.
Why is that? Why has it taken us so long to renovate some of these hospitals and structures?
There's some renovation that has been done, a few renovations here and there. You will go to a facility and only the OPD has been done or the maternity has been done. But now our policy is that we are doing a total overhaul of most of these facilities, and this is what is in the new plan.
Was it a lack of money? Or a mismanagement of resources?
It's not mismanagement of resources, but it is also according to priority. Because if we are to renovate a facility, there are many issues that we look at. Many hospitals are not in very good state, because you will go to one area, someone will tell you, my hospital is in a very sorry state. You go to another one from different parts of the country, but some of them could have had minor renovations. But now, for us as a sector, we do a total assessment of all health facilities throughout the country, and we pick out those that are immensely dilapidated, because many people think that their facility is the one that is dilapidated. But for us, we pick out those ones that are immensely dilapidated, and this is what we are looking at as per now. That is why we chose those ones. Another issue we look at is we look at the catchment area and how many patients does the facility service. Now the hospitals that I am talking about that are under renovation with the funding from the World Bank, after looking at the level of dilapidation, we also look at patients that they receive. We are looking at hospitals that are along the highway, because we have hospitals like Uganda that is along the highway that really needs a total overhaul. We have hospitals like Nebi. We have hospitals like Mitiana, which is really bad. Kiliandongo.
It sounds like a very detailed strategy, which we do appreciate, the Ministry of Health taking on. Let's just delve straight into necessities such as electricity and water, like we saw in the story that aired last. Why is it that we're increasingly seeing a lack of basic necessities like water and electricity in hospitals? I mean, they are forced to function without these necessities.
The major problem is that there could not even be running water, not because the facilities have not even been able to pay for the water, but you'll find that the pipes themselves were installed as late as far as back when the hospital was done, that is in 1970, 1960, and the fact that no renovation has been done, the pipes are blocked. They cannot even do any renovation on that. But what we have been doing is that, especially for the general hospitals and maybe the health facilities, we have been asking the local governments that have the mandate for some of these hospitals and health facilities to ensure that they give in money so that the hospitals are able to pay for this cost and be able to ensure that the blocked pipes are unblocked. And even for power, as a sector, we have been installing power, the solar system. We have installed the solar system on most of the health center floors, because we know some of them are not along the grid and cannot access power along the grid, the Umeme line. So we have ensured that we install solar systems on all these health facilities.
Okay, one of our viewers on Facebook, Betsy Agaba, says, you know, we've witnessed the state of hospitals in hard-to-reach areas, aside, of course, from being inaccessible. Health workers are not compelled to go and work, you know, in these areas. Is the Ministry of Health doing anything to offer any incentives to have health workers go into these areas?
Yes, we have a strategy for motivation and retention of health workers. And other than the basic salary that we give, especially for hospitals and health facilities, we have asked the local governments to give an allowance on top of the salary that the health workers are doing. And also this World Bank project, we are also giving scholarships for health workers working in the hard-to-reach areas. This is a way of motivating them that when they get the scholarships and they are able to study, we are able to retain them at the facility. So when you get a scholarship from government, surely this is an incentive to you and also be able to work and stay in the health service.
One final question, because we are out of time. Dennis Semanda on Facebook says, how about the scarcity and inadequacy of drugs in most hospitals, only to be advised by the doctors to go and purchase them from drug sellers or pharmacies? What are you doing about that?
One, we are working closely with national medical stores. National medical stores is mandated to distribute these drugs and other health supplies. So NMS has done a lot to ensure that these are outside. But the only challenge we find is that at times when NMS delivers drugs, and we see many people coming to the facility even when they are not sick and they just want to take the drugs that are there. But however, as a government, we're putting in more resources to ensure that we have adequate drugs in the facilities.
Oh, thank you so much for taking time to speak to us. Unfortunately, we are out of time, and that's all the issues we could address this evening. That was NTV Take 5 with the Ministry of Health spokesperson Rukia Nakamate taking your questions.